everyone here today at this UNFPA Safe Birth Even Year event as a side event of the General Assembly of the United Nations. I am Maria Rosa Cutillo. I'm the chief of the Strategic Partnerships branch at the United Nations Population Fund. My office has the pleasure, the honor to work with the partners that we have here today to discuss with us, to talk about partnerships, to talk about the importance of the private sector in achieving zero unmet need of family planning, zero preventable maternal deaths, zero gender-based violence and harmful practices. Today, we will concentrate on zero preventable maternal deaths with our partners. And I will be very brief in this introduction, but I just wanted to make 2 points. The first one, a little bit less than 2 years ago, an unprecedented multi-stakeholder public and private platform came together in Nairobi to celebrate 25 years from the International Conference for Population and Development. And all these partners came to Nairobi with commitments, but the commitment from the private sector was a bold, concrete and strong commitment, $8 billion for the agenda for women and girls. And we're here today to see the progress around those commitments. And we're here today to discuss about that with our private sector partners who are and have been also during the pandemic on our side every day, building resilience, building partnerships. We're grateful, and we want to launch a strong message on the importance of partnerships during the General Assembly. The General Assembly is a moment where all the international community comes together, and we are together in the journey to achieve the Sustainable Development Goals. Today, it's also an important day because 1 year ago, on the 17th of September, the high-level commission for the Nairobi Summit was launched. This is a commission that actually tracks the progress on the achievement of the commitments that were made in Nairobi. And it's, again, a multi-stakeholder commission. It brings together public-private partners in the spirit of a truly inclusive multilateralism. It's, I think, a one-of-a-kind also mechanism of governance around achieving commitments after the Nairobi Summit. The second reason that I would like to flag for why we're here today, it's because, as we will hear from Annika, my colleague from the technical division at UNFPA, there is an even stronger alarm on maternal health in the world. We cannot wait. We need partnerships for that. And this is why today we are talking again and we are relaunching the Safe Birth Even Year campaign. This is a time to catalyze efforts, to talk about maternal health, to make sure that we leave no one behind, starting with humanitarian and fragile contexts. And we will have also the voices from Haiti. We will have our country representative in Haiti. We will have the voice of one of our midwives who are on the front line every day to implement the agenda for women and girls. So without further ado, I will leave the floor to a friend, to one of our most important supporters, Claudia Lumor, who is our honorary Goodwill Ambassador in Ghana. She's the founder and CEO of Glitz Africa, and a strong, bold, outspoken supporter of UNFPA agenda. Claudia, I leave the floor to you. Thank you very much. And thank you all for being here with us today.
Thank you, Maria Rosa, for your eloquent submission, and thank you for my introduction. You're always very nice. Thank you all for being here, all our participants, all our speakers, making time to have this very impactful discussion. I'm really looking forward to it. I think before we start, we will give the floor to Annika. Annika is the Chief of Sexual and Reproductive Health Branch of the UNFPA. She will give us an overview of the global situation of maternal and newborn health in the context of COVID-19. So Annika, if we can leave you, if we can bring you in, and also all our participants, if you have any questions, you can post them on our YouTube channel as we go along, and we will let your questions be heard by the speakers as well.
Thank you so much, Claudia. And if I can have my slide on, that would be wonderful. So I will take these 5 minutes to talk about why this is such an important issue that still needs our full attention, and why UNFPA sees a certain solution as one of the key solutions. And I'll come back to that, and we'll talk more about midwives later. But let me, in these 5 minutes, it's not a long time to give you an overview, but focus on 3 messages. The first one is that we are not on the right track. We were not on the right track on maternal mortality even before COVID. And what we have seen is that the decline in the last few years has plateaued, and we still have 800 women dying every day from preventable causes. And we are really not on track with the SDG target of 70 per 100,000 live births by 2030 that was set out. And we also know that 94% of all these preventable maternal deaths happen in low-income countries. And even more importantly, more than 50% of those happen in countries that are affected by human crisis. So we know what to do, but why then aren't we succeeding? We know that there is a lack of sustainable investments, and that will make weak systems pertain in weakness and remain so. But we also know that there has been too little attention to the complexity of root causes, such as why women cannot access, or why care, or why they get pregnant too early in life, and why institutional care is not preferred by women, even when they can make those decisions. My second message is how COVID has exacerbated both the direct and the indirect causes. Maternal mortality ratio measurement is a very blunt instrument, so it's very hard to say how the direct numbers have been influenced by the COVID pandemic. But what we know is that accessing care has been more difficult. We know that the care that has been provided has been of less quality because midwives have been moved from one clinic to another. But we also know that the closing of schools and safe spaces and clinics have influenced what we see today in increases in child marriage, increases in early pregnancy. And we have estimated that there might be even 610 girls, 1,000 girls more in sub-Saharan Africa at risk of child marriage, and more than 540,000 at risk for early pregnancy. And we know what that does to maternal mortality. We know that that exacerbates maternal mortality. We know that sexual violence, sexual abuse has increased. The poverty where young girls need to go to find, ways of even selling their bodies to get food to their family, that has increased. So we really need to look at the real numbers, but not only on those direct maternal mortality numbers. My third message is about the solution. We need to invest in midwives because that is a holistic solution for women everywhere. And I stress that. It is the importance of women that we're looking at. Not only their survival, but their experience of a good birth experience, they need to have the care, not only the services, they need to have the care. And I think midwives are the backbone of the health system. And we know that in crisis times, a resilient health system will show itself in how it can really save lives and maintain health and well-being of people in that crisis. Lastly, I would like to say why we are so sure about the importance of investing in midwives. We earlier, in end of 2020 and beginning of this year, put out a study that shows that if we can have midwives deliver a lot of the SRHR services, we actually looked at 31 different types of services, so not just childbirth and the aftercare and the antenatal care. We know that if we have a universal coverage of midwives, that can save 4.3 million lives per year up to 2035. But even a small increase of 10% coverage of midwives can save 1.3 million lives per year until 2035. Let me end there. Thank you.
Claudia, you are on mute.
Sorry, thank you, Annika. Thank you so much for your insightful remarks. And you really touch on things that, as a goodwill ambassador for UNFPA, something I'm really passionate about here. Early marriages, early pregnancy, child marriage, and these are things that we live with it, we see it in front of our eyes all the time. So hearing you talk about it is something that really touching on the core of things that we can all connect to it. So thanks for that. And then talking about investing in midwives, we are going to have Yves Sassenrath, who is the country representative of UNFPA in Haiti. She is, but before we do that, she's a midwife. But before we go into that, we have a video that we will play that will show you an interview with the health personnel from Haiti. So if the video is ready, can we see the video, and then we'll come to just bear with us. We have a short video of an interview with the health personnel from Haiti. Okay, there we go.
Claudia, maybe there seems to be a technical problem. Maybe we can go to our country representative, Yves Sassenrath, to talk about the call to action on Haiti. Thank you, and we will show the video as soon as possible.
Yeah, okay.
Yeah, hi everybody. Thank you very much, Claudia, for the introduction. That's what happens in live events. We cannot always control the technology, but that's why we are human beings. We can step in. Actually, just like to thank you very much for this opportunity, everybody, and greetings from Haiti. Can you hear me? I have an unstable connection. Can you hear me?
Yes. Yes.
Yes. Yeah, please go ahead.
Hello?
if we can hear you.
I have an unstable connection. Can you hear me?
Yes, please, we can.
Okay,
yeah, please go ahead.
I'm going to switch off my camera because I have an unstable connection. So I'm calling in from Haiti, and thank you very much for this opportunity. The reason why Haiti is yet again on the headlines is because we, as we probably all know, we had a month ago, we had another very bad earthquake. The last earthquake was some 20 years ago, and the earthquake we had a month ago of a magnitude of 7.2, which is quite serious, struck the south. It basically killed some 3,000 by now people that are either killed or missed. Over 13,000 are injured, and the figures are climbing. What needs to be said is that the earthquake really happened as part of multiple storms that the country has been inflicted with. A social storm, the assassination of the president, as you know, tropical storms just a couple of days after the earthquake, which basically affected over 140,000 families, 500,000 people in 3 provinces are directly affected, and 40% of the total population in the affected departments are in need of emergency assistance. As we all know, and as Annika also mentioned it, in these crises around the world, we see pictures from Yemen, we see pictures from Afghanistan, and in Haiti, it's not different. Women and girls, and especially women in reproductive age and women that are pregnant, are always the most vulnerable in these situations. And in this particular situation in Haiti, we have some 22,000 women that are projected to give birth in the coming 3 months, of which some 4,000 are likely to have complications and will need cesareans. This obviously calls for immediate action, which UNFPA did. We were already present in that zone, working on large midwifery and maternal health projects. So we had midwife teams already in the region. Unfortunately, some of them could not be deployed because they themselves were affected, their houses were affected. We were able to bring in immediately in a span of less than 10 days, over 3,000 kids, dignity kids, to be immediately deployed. We set up temporary maternity tents because some 40% of the health facilities were either totally destroyed or totally not accessible. And we were deploying teams to do immediate sexual reproductive health and maternal needs assessments, as well as setting up mobile safe spaces for women to protect them against gender-based violence. Next, please. So what we are now planning to do, and that's where we really do this call for action, because we have the first moment now behind us with quite a massive humanitarian response across all the different humanitarian sectors. But as you know, usually the sectors that are mainly getting attention are the traditional sectors that are extremely important, obviously, which are shelter, food, nutrition, access to water, the whole sanitation system. But what is sometimes not on the front line, even when we talk about health, a lot of traumatology is being put forward, but the women's health, the maternal health, the protection against sexual-based violence, which affects hugely the mental health of women, and especially women that are in reproductive age and pregnant, is the entire area of maternal health. So we need to make sure that maternal health and the health of women and girls in these situations are equally important and equally funded than the traditional sectors that I just mentioned. So what we really need now is support to strengthen the 40 health facilities that we are working with the national authorities, so that we can manage pregnancy-related complications and basically reduce as much as possible unwanted deaths during childbirth in this situation. We are in dire need of obstetric facilities that are mobile, so that we can strengthen facilities that have the facility for traditional births on normal births, but we need to strengthen those with capacity for cesarean sections, so for C-sections. Sorry. So we are right now planning to bring in these mobile facilities. As you can imagine, there is a lot of resources are needed for the immediate cargo, etc., and also the deployment of additional human resources in the form of midwife teams. In that sense, final slide, please. We are calling for some $9.2 million that are immediately needed to be able to address those needs. We have already been able to mobilize some of this money graciously from some governments immediately. And we are really hoping that this call for action will be up there with the other calls in the world that we are sadly competing with, which basically is other crises that are very important. Haiti is an ongoing crisis for the past decade, and with this situation, obviously, we can sometimes even feel that it's almost a forgotten crisis, and this shouldn't be so. So with your attention and your support, especially for women and girls in these situations, we are sure, and we are sure that we can overcome this. Thank you very much.
Thank you so much, Yves, and thanks for sharing all of that. And sorry to hear all the things that's been happening in Haiti, and the great work you're doing, providing human security to all the people in Haiti, especially women and children. So that's we have to commend you for all the amazing work you're doing. And yeah, we sympathize with all the things that's happening as well. We are running behind time, so maybe if the video is ready, we can quickly show the video, but if not, then we will move straight into our panel discussions, and I can introduce our panel. So we can, if we have 2 minutes and the video is ready, okay, we can.
Comme sage-femme, journée de travail le plus souvent yo débuté mais yo presque pas terminé parce que nous toujours gagné des choses à faire, des patientes qui méritaient une attention, un soin quelconque. Nous commencé ouais patiente qui avec tranché et malade qui dans situation d'urgence tant qu'au matin un malade qui nécessitait une intervention chirurgicale immédiate qui pas attendre. OK. Le plus grand défi santé maternelle là en Haïti, c'est la réduction du taux de mortalité materno-infantile. Et jusqu'à nos jours, nous gagnons encore des femmes qui mourent pendant qu'ils ont la vie et des petits bébés qui ne pas arriver à découvrir la vie. Des fois, c'est parce qu'ils n'ont pas arrivé à temps. Des fois, ils ont un espace là à temps, mais manquer matériel, manquer les médicaments d'urgence. Au soir, ils n'ont pas accouché tout en présence des professionnels qualifiés et compétents. Des fois, malade là, ils considèrent comme un proche. Parce que des fois, il y en a qui viennent accoucher qui pas accompagné de personnes. C'est nous seulement qui là. Et ça fait des fois, ils considèrent nous comme un membre de la famille, comme une sœur, comme ma tante, comme une mère. Tremblement de terre, là, t'es promené dans l'espace ça, puisque moi, c'était seul monde qui était arrivé dans le travail juste ça. Et nous t'ai constaté tout. En pile femme qui était venue avec douleur, qui était causée à stress, parce que stress là vient déclencher travail là, il y a une femme enceinte qui vient qui frappée, qui blessée, qui tombée, même gens avec ça qui était dans l'espace là. Donc nous t'ai faire meilleur de nous pour nous te bailler soin malgré nous pas de idée de comment la caille pas nous parce que moi même personnellement moi t'ai oublié téléphone mais la caille moi pas carré et pour me connaître comment petite moi et pour me connaître comment famille moi Quand là, moi gagné, c'est à cause du tremblement de terre qui était passé 14 août là. Et puis, il a fissuré plusieurs côtés. Donc, pour nous capables de protéger, nous éviter de prendre des risques, nous mettons tante là, surtout avec bébé, pour nous capables de dormir. Comme nous vivons dans un pays côté système santé nous en vraiment faiblesse, je trouve que les femmes jouent un rôle qui est très important dans la société. Bon, Loudjina Dori la semaine dit c'est grâce à lui parce que personne même maman pas de convaincre moi pour me opérer, l'autre monde pas de convaincre moi me venir arriver comme si me venir agressive parce que me dit pas faire pas opérer quand il a lui même il était toujours là, il très patient, très patient avec juste il était arrivé convaincre moi et puis toute bagaille passait très bien. Satisfaction moi c'est le qui me baille son occupation dit que il était satisfait.
Oh, what a touching video. I mean, obviously, midwifery is a really rewarding work, and bringing life to earth is a beautiful thing. But for some of us, and living in Africa and other places as Haiti, sometimes it's like a punishment for some of the women because we see it right in the midst of it. Getting to clinic on time, culture and tradition doesn't allow us to see healthcare. So it's right in the midst of it. So I can really connect to that video and what you're showing. And Yves, I have to give it, to you again for the amazing work you and your team is doing in Haiti. And God give you strength to keep pushing and getting all the support from amazing partners that UNFPA have as well. So we will go into our partnership, our panel discussion, and hopefully this discussion is hopefully to address some of these issues. So our discussion really is based on the current landscape of maternal health in the midst of COVID-19 and the importance of reducing maternal mortality through partnerships. And I think that's why Maria Rosa and the team has done amazing work bringing partners here. Before the onset of COVID-19, some 808 women died every day. And for every death, another 20 to 30 women suffer acute or chronic illness or disabilities from preventable causes related to pregnancy or childcare. The fast-moving COVID-19 situation has further limited access to sexual and reproductive health services for women and children around the world. The WHO National Pulse Survey on a continuity of essential health service during COVID-19 found that 94% of 135 countries reported some kind of disruption to sexual and reproductive health care in just Q1 of 2021, which is huge. There have been increases in maternal deaths, stillbirth since the pandemic began, and with great disparity between high and low resources countries, and it's still ongoing crisis, so it's never ending. So we would like to start the discussion with our panel from the International Confederation of Midwives to further expand on how, coming back from the video that we even watched, to further expand on the current situation that is affecting midwives, and also coming from seeing what we saw from the video. So Sally Perman, she is the chief executive for International Confederation for Midwives. They work to strengthen the professional association of midwives in 124 countries throughout the world, where these associations represent over 1 million midwives globally. You have been working closely with UNFPA and WHO and other UN agencies, other global professional organizations, including the International Federation for Gynecology and Obstetrics, FIGO, the International Pediatric Association, the International Council of Nurses, non-governmental organizations, civil association, and the private sector. So you've done an amazing work working with all of this. Can we, if Sally, we can ask you a question. So you recently conducted a major research in collaboration with UNFPA and Johnson & Johnson's on the impact of COVID-19 on midwives. Could you highlight on some of the findings of the studies to all of us and the challenges that midwives are facing during the pandemic?
Sure. Thank you, Claudia, and thank you everybody for the invitation to participate in this session. It's great to be here. Indeed, last year, ICM, with funding from UNFPA and Johnson & Johnson, we undertook a survey of our 143 midwives associations located in those 124 countries that you mentioned, Claudia. We wanted to better understand what was the impact on our community of the pandemic, and what were the issues that continue to face midwives and the women and communities in their care. And we already knew before we even started, because we'd been talking with our associations, that they were saying this, as you've just said, increase in gender discrimination, domestic violence, human rights abuses, over-medicalisation of birth, fear, misinformation, a growing distress amongst women and midwives. And, we weren't at all surprised to find that this study provided the evidence of what midwives, especially, and their allies have been saying, which is that midwives' critical role has not really been rightfully acknowledged, and that midwives across all contexts have been ignored and undervalued. And that when that happens, when midwives and midwifery is deprioritised, then women and newborns and future generations suffer. We had over a 71% response rate, which we were really pleased with, given that this was being done in the midst of COVID. And we found, these are just some of the main points, that just over half of the associations actually received any information from their in-country health authorities, and 87% of them were relying on information that we could provide through our website. Some 75% of women were afraid to attend maternity services, or facilities, I should say. And this was really reflected. There's something like 73% reduction in attendance to facilities during this time. And the study was undertaken, in the sort of early months of COVID. So of course it's different in every setting. But some 50% of midwives reported being deployed outside of maternity services to care for COVID-19 patients, which meant 60% of them reported that there were then midwife shortages, and that midwives on the ground were working much longer hours. And 66% of midwives also reported a lack of PPE. They just didn't get it. They weren't prioritised, and they were frightened themselves to even go to work and to bring COVID home to their families. Some 57% reported that the midwifery education programs just closed altogether. And of those that didn't close, there were really difficult problems for the midwifery students to get hands-on experience. The associations reported that many more women were wanting home births, and as much as 44% increase in home births, 18% in community antenatal care, 31% increase in community postnatal care, and 50% increase in having care through virtual technologies compared to what they were doing before COVID. And where more women wanted home births, there were not enough midwives to provide that care. But many women gave birth in places different to their original planned location. And 10% of women were unable to access a midwife at all. So those are just a handful of the results, but I think it really shows, the way in which midwives and women and their communities have been impacted. And we know that if the health and well-being of women and girls is underfunded and undervalued historically, what we now know, I think we all know this, is that COVID-19 has just aggravated that problem. So we've got, poor, degrading work conditions for midwives, compromised inadequate care for women. But on the other side of it, we also saw through this research that resilience and perseverance are innate to midwives. And lots and lots of stories of midwives upholding care despite limited resources, providing care when no one else was there, accepting the fact that they weren't being paid, dealing with the reality of illness and death in their communities with women, and, you know, using all kinds of innovations around PPE and keeping women and themselves safe. And I think probably overall, you know, their message is that to build back better from this pandemic, we really need to look at midwife-led continuity of care models. We need to look at more community-based primary health care approaches to maternity care as we redesign our services. So thank you for that, Claudia.
Thank you very much. It's a shame that midwives are still being undervalued. I know the relevance of my midwife when I was having all my 3 kids. So, so hopefully there is solution to this. If I can ask you another question as well, because there has been a report, a World Midwifery report that highlights that midwives can deliver over 90% of the key SRM and intervention, yet they count for less than 10% of global health workforce. And there's a shortage of 900,000 midwives. How can partnerships help to meet some of these key recommendations of the report as related to creating an enabling environment for midwives, improving their education and leadership and all of that?
Well, it's a big question, isn't it? And of course, none of this has helped. I mean, this 900,000 shortage that we saw out of the State of the World's Midwifery 2021, that's been exacerbated further, of course, by this, education programs not continuing during COVID. So it's worse than that. But that report is really important, giving us a sort of guidance to the sort of main issues that we need to focus on. And I think it's, it's taken very seriously by us, certainly by UNFPA, WHO, UNICEF. We meet with them regularly to talk about our work and how we can work together and not duplicate effort. And there's many other partners who are also using this report as a guide. And I think we're all, very much focused on how to address some of the issues. I think, in terms of the enabling environment, I mean, there's some really big challenges here. Midwives are often working in environments that don't value them or enable their skills. They don't get to work to their full scope of practice. So therefore they can't provide the best quality care. There's also low pay, disrespect, harassment, low status because they're women and they're caring for women. And in partnership with Ariadne Labs, ICM, we've just recently published a policy brief on the enabling environment because we're trying to help governments, in particular ministers of health and others, to understand how the context that midwives are working in makes a difference to whether they can provide quality care. And so we've really tried to define what is enabling environment mean within the context of midwifery and for midwives, and looking at the infrastructure of the health system, the profession, the policies, the enabling or disabling policies, and system level integration that's really needed for midwives to effectively practice their full scope. We're also focusing on education and working closely again with UNFPA. We've just rolled out a professional framework for midwifery to try to describe what are all the pieces that need to be in place in a country for midwives, for the profession to be effective, but for midwives, most importantly, to be able to provide the best care. And at the centre of that is the midwifery philosophy, approach to care, the model of care, and our essential competencies. Those are the things that make us different to others, health professionals. And then education, regulation, midwives association, research, leadership, enabling environment, and gender equality. These are the components that need to be addressed and strengthened. So for midwifery education, there's many, many problems. We don't have enough teachers, we don't have good quality education programs, they're under-resourced, and often working from very out-of-date curriculum without good connections with midwifery practice areas. So we are working with our colleagues in WHO and UNFPA in particular, and Johnson & Johnson, to really try to address these issues and provide more resources for midwife educators to help them to strengthen programs in their countries. So that's some really important work. It's going to take a long time. In terms of leadership, we know that midwives are absolutely underrepresented and overlooked for formal leadership positions. There's lots of things that contribute to that. But without midwives in well-resourced leadership positions, women's rights actually will be left off the health agenda, because often it's midwives that are bringing those women's rights through to the table. So strengthening leadership is something that we are really all thinking very seriously about. We're building out a leadership development approach at the moment, and we're trying to work on the idea that every midwife is a leader, and she is, with every woman she works with. So how do we foster that? How do we build that? And also we're focusing on young midwife leaders, in particular with Johnson & Johnson, because they have an amazing opportunity to develop as leaders. And lastly, just a little mention, because I know you may not have time to go to my food to go to another question, but I just want to mention the push campaign, which is something that ICM is doing in terms of our decade of the midwife, the next 10 years, now 9 years, until the 2030 SDGs, and really trying to sort of bring attention to midwifery and women's rights. And so I think it dovetails really nicely with this UNFPA's Safe Birth Even Here initiative. It's a decade-long campaign. We are trying to, it's a movement for women and midwives who protect and uphold their rights, the rights of women and their bodily autonomy. We're trying to bring in many new and existing partners to focus on midwives as the solution to ending preventable maternal and newborn death. And of course, we really hope that everybody on this platform is going to join our efforts with the push campaign, and I'm happy to talk more about it. But I absolutely want to just say that none of us can work alone. We must work together in partnership, and we must be aligned, and we need strategies together so that we are aligned. Thank you.
Thank you, Sally. I think from what you're saying, clearly partnership, your amazing partnership with Johnson & Johnson has really worked, and it's continuously making an impact. So it shows the strength of partnership in solving situations. Because we're a bit behind time, we will end it there and then move on to your partner from Johnson & Johnson, which is Chimili, Director of Global Community Impact. We would like to also speak to you on these partnerships and the amazing work you've been doing as Johnson & Johnson with COVID-19. So Johnson & Johnson has a long history of championing the health and empowerment of women and girls. Johnson & Johnson reaffirms the commitment during the Nairobi Summit, in addition to establishing the Johnson & Johnson Center for Health Workers, Innovation Proud to COVID-19, which focuses on closing the frontline health workers coverage gap and building a thriving health workforce for nurses, midwives, community health workers. The pandemic has highlighted the challenges and the importance of frontline health workers, which we've all seen from the video and even from what Sally spoke about as well in tackling the pandemic. But we need to continue with the service. So Chimili, if we can hear from you, we would like to know what Johnson & Johnson has been one of the leading forces in fighting against COVID-19 through the development of your vaccines. At the same time, we know that you are also investing in frontline health workers and ensuring that they are empowering and continue their life-saving work that they do, and especially in these difficult times. Can you please tell us more about the work, the efforts that you're doing, and why it remains so important for your organization to support frontline health workers?
Yeah, thank you, Claudia, and thank you, UNFPA and partner on this panel, the support and inviting us. I think I'll try to make this really brief because both, Sally has talked about some of the work that we're doing with ICM and UNFPA. I think for if you listen to the last message that Annika delivered, the solution, investing in midwives, and this is exactly what we heard and what we're doing. And investing in midwives and other frontline health workers. And I think for us, it's no-brainer. And vaccines don't, get to people's arm by itself. You need health workers to deliver those, and services the same. They don't just happen, and you need health workers to do that. So we had a long history of supporting frontline health workers, but I think with the center, it really helped us focus on our resources to really address some of the challenges that health workers are facing, that including education, including leadership development, including burnout. If you hear what Sally would talk about the COVID studies, I think two words really stand out. One is fear, both fear the fear women has and midwives have, and burnout. These frontline health workers, they burn out before COVID, and then it's even more so. And also their kind of heroic, resilience and perseverance. I think for us, I think supporting frontline health workers, recognizing both the challenges they're facing and what we can do to support them is important. And the other thing about partnership, I'll say that we know that we can't do everything, and there are things that just we're not positioned to do well, but we can use our voice to bring awareness to those issues of compensation, issues of decent working environment, including access to PPEs and protections. So these are kind of about 4 or 5 areas that we, we're working with various partners that we're doing. I would just want to say that during COVID, and we worked with our partners, including UNFPA, and really pivot some of the existing work. I thank our partners for that and providing PPEs to these frontline health workers. The other thing I'll say that our focus is on midwives, the community health workers, and nurses, who really the backbone of the primary care. So we're still in COVID, but there's a lot of talk about post-COVID, how to build back better. I think we could probably all agree that one of the things that COVID impacted is the distrust between health systems and people who are access. I'm sorry about the noise. I think midwives and community health workers, these frontline health workers, plays a key role to bridge that that gap and build the trust back, because they are deep into the communities. These are kind of philosophies and why we are focusing on frontline health workers and what we're hoping to do. And a year ago, we participated in the Nairobi Summit, and we affirmed our commitment towards these frontline health workers so that women and children in the communities can benefit more long term. So I'll stop there, hopefully.
Yeah. Thank you very much. If we can just ask you our last question to you. You are founding members of the Safe Birth Even Here campaign by UNFPA that aims to encourage private sector partners to come together to end preventable maternal death. What is your message briefly for other companies like Johnson & Johnson for leveraging their capacity in ending preventable maternal and newborn deaths, please?
Yeah, I would say that before Safe Birth Even Here campaign, we never joined campaign before. So this is the first. That was the first time that that we was, oh, we're not sure what to expect. So we participated in the campaign and program. There are a couple of things I'll highlight. That the campaign was very successful. Like I said, this is a huge lift, and then it's no one organization, if I dare say, not even WHO, can solve all these problems, and so everybody needs to come together. So the campaign really provide a platform for all the organizations to join, and I would say, like, for J&J, if I would say selfishly, it also bring visibility to the work that we do from a reputation perspective. So I think for companies and corporation private sectors, I do think there's benefits on both sides, or if you will, win-win situation to support the campaign. The other thing is that before Save Birth even here program and campaign, that we were not sure about these very fragile settings, whether we are going to get results or not, because they're fragile, and you build something and something happens, and then it destroys things. But I think our experience in Haiti, Pakistan, and Liberia really proved, particularly Liberia, in terms of even in fragile settings, you can build a stronger health system that could be resilient to respond to other emergencies.
Yeah, I totally agree with you. Thank you for that submission. And talking about partnership, we'll go to another key partner, which is the Royal Philips, and speak to Mr. Jean-Villain Schwangrein, who is the Vice President, Global Government and Public Affairs. Forgive me if I murdered your surname. But Philip, what I love is your mission, because you have a mission to improve the life of 3 million people annually by 2013, which is a huge mission, but no doubt it will happen, and I'm sure you're working towards that. You also aim to positively touch 400 million people in underserved population. During the Nairobi Summit, your company also committed to mobilize up to $100 million of investment with partners for large-scale production focused on high-quality integrated health service in Africa that support healthy pregnancy, safe delivery, and what we're all passionate about, newborn care. So if we can ask you 2 questions, I'll just sum it up, and maybe you can briefly, if it's not too much, sum it up for us. And we would like to know what value adds to private-public partnership for maternal health, and how do they help to foster innovation? And also, how can private sector entities like Philip contribute to unlocking the necessary financial investment to end preventable maternal health?
Great. Thanks very much for the invitation, Claudia, and thanks for the panel. I'll try to be brief. So let me start with the bigger picture about the challenge that is ahead of us with maternal mortality. Of course, we already experienced in Ebola that the ones that are really suffering during a disease of infectious disease are fragile people, for people with conditions, and pregnant people. And at that time, at the Ebola crisis, we already said we need to redesign the healthcare system. Sally made the point, we need to redesign service delivery. And so here we are in COVID. Yes, we found that we need to redesign the healthcare system. And in fact, we need to build a resilient healthcare system. Now, it's very good that the week's theme of the UN General Assembly is about rebuilding resilience through hope. Well, hope is great. We think a strategy might be needed as well to actually realize it. But let's think about what a resilient healthcare system means, because a lot of talk about it, but people may not understand. So it is the capacity of the health system to deal with whatever crisis, to plan for it, to adapt to it, to learn from it, to recover from the crisis, at the same time minimizing the impact on the population health. Well, clearly, none of the health systems were able to deal with that. They impacted the population health because they were denying other services. And then it's able to continue the other services that are needed outside of the crisis. So those elements were failed. If you ask a lot of healthcare professionals if their healthcare system was resilient, they say, yeah, it was very resilient. We were really resilient. We adapted to the situation. Okay, yes, but ignored everybody who didn't have COVID. So now that we need to rebuild that, that's complex enough as a technology company to step into. I mean, we have our ultrasounds and we have our platforms and we have our CT scanners and everything else. It was already complex enough as a single intervention to get it into a system that is broken. Now that we have to redesign that and we add to that the digitization challenge that everybody has to deal with, it's getting even more complex. So definitely that's where we need that partnership. So the digitization aspect is important. A resilient healthcare system, it's gotta be a digital system. So we love to partner with the UNFPA. It's a true partnership that helps us to understand each other, understand the different perspectives. So we agree with each other, we learn from each other, we fight with each other, we love each other. It's a great partnership. And I think it's important that we have that partnerships and such partnerships, because with that partnership, we become a broker of trust. So an example of that is how we work in the country of Congo Brazzaville with the stakeholders, with the government. Philips doesn't sit on the seat of the UN. It's a different position, right? But we are able to redesign delivery, emergency and obstetric care at the country level. And that partnership is really, if that works, we hope to be able to touch 50 million lives of women and children in the next couple of years. And then on top of that, of course, we need the investment. Now, let me move to that investment side. Why is it so important? So apart from partnership in this super complex area where we need to transfer to resilience, right? We have the digitization. And then, of course, we need some more money. Because in the end of it, it's all about how much money is available to invest in this. Now, we know donor money is not enough. The national budget is not enough. So we are really thinking that a double blending of vehicle or financial instrument is necessary to unlock funding in the projects that we've designed so eloquently and so well with so much passion. What you see, and made it very short, on the investment side, capital is not there for maternal health, for primary healthcare, because it's of very high value to society, but it's not investable. So we need to de-risk the capital in different ways. You can do that with grant, first loss guarantees, and other elements. De-risk capital to invest in the healthcare systems. But once you invested the capital, somebody needs to pay back. There needs to be an income to pay back, right? I mean, you invest in something you want to return, even if it's a thin return. Very often these returns don't come. The insurance premiums doesn't come, the government doesn't pay their fees, out of pocket is not sufficient or not reliable. So we need to strengthen that side as well. So strengthen the investment side, strengthen the revenue side, double blending. So with Health Financing Coalition and others, we are setting up a fund of 100 million following this stream. And it's not exactly new. I think it's innovative in healthcare, but this has also already happened in renewable energy. So we're trying to learn the lessons from complex, long-term, complicated business models and invest in healthcare. And next year, I'm sure we'll be able to do that. And then resilience is not just a hope, but it's also backed up with lots of money. Thank you.
Thank you very much. I like that it's not just hope, but it's also backed with a lot of money. Because sometimes we give hope, but hope is not enough sometimes, as you know. So thank you very much for your submission and for your partnership, continuous partnership with UNFPA. If we can quickly go to Ferring, which is another partner for UNFPA, and Lisa Thompson, we have her here, she is the Senior Medical Affairs Director. Lisa Thomas 2 years ago at the ICPD 25 Summit in Nairobi, Ferring made a commitment to work towards making its heat-stable formulation of carbetocin accessible to public and non-for-profit facilities in all low and lower middle income countries for the prevention of critical bleeding after childbirth or postpartum hemorrhage. This is something we see a lot. I've had a lot of close family members who've experienced that. So I'm passionate to hear what you will say about this. If we can quickly also ask you two questions and go through it for us. So if you could tell us a bit more about how you hope this commitment will be able to help us advance towards ICPD 25 vision of zero preventable maternal death. Where are you now in terms of your commitment, taking this commitment into action, where you are at the moment, and maybe what is next? We're sorry, we are running a bit behind time, but we're hoping that you can briefly discuss this with us. Thank you. So if we can have Lisa Thompson.
Sure. Thank you very much, Claudia, and UNFPA for the invitation to participate in this very important and compelling panel discussion. And just to cut to the chase, we are making significant progress around realizing this vision. And we heard a number of very important statistics from Annika and the other panelists, but I just want to underscore that postpartum hemorrhage is the leading cause of maternal death worldwide. And many of these deaths are preventable. So heat-stable carbetocin was developed through a public-private partnership. Ferring joined the World Health Organization and MSD for Mothers in 2013. They specifically developed this heat-stable formulation to answer the need due to the instability of uterotonics due to cold chain and other storage conditions. So basically, there was a landmark trial, the Champion trial, which was conducted and funded by MSD for Mothers. And following the results of this trial, WHO included heat-stable carbetocin in their recommendations and essential medicines list for prevention of PPH. So that's an important example of public-private partnership and significant gains. So today we are excited to announce a new collaboration with UNFPA. UNFPA will pilot the introduction of heat-stable carbetocin for the prevention of PPH in selected sites of their humanitarian operations in Uganda and South Sudan. Now, this is important because Uganda hosts 1.4 million refugees and asylum seekers who are fleeing from violence and civil war in neighboring countries. South Sudan has 1.6 million internally displaced persons and literally the highest maternal mortality ratio in the world. This is actually an implementation research project which will be conducted by UNFPA and their partners on the ground. It will include training of birth attendants in prevention and management of PPH, as well as other obstetric emergencies. I would like to point out that this research will, first of all, build the evidence base on how new medical technologies, such as heat-stable carbetocin, can be introduced in the humanitarian context, and most importantly, provide access to safe birth in the most vulnerable settings. Back to you, Claudia.
Thank you. Thank you very much for sharing that with us. And that was nice and brief and very impactful. Thank you. And for your partnership with UNFPA and all the amazing innovation happening. And thank you. Mary Ann, if we can briefly go to Mary Ann Itibet. Mary Ann is AVP Health Equity Lead for Merck for Mothers. So MSD for Mothers was among the first private sector committed makers of the Nairobi Summit and was a strong supporter of UNFPA campaign to secure the $8 billion commitment from the private sector to achieve the 3 zeros. You are also a commissioner for the high-level commission on the Nairobi Summit on the ICPD 25 follow-up. An important part of your work is in investing in local private providers to ensure that they provide quality care as well as to integrate them into national health delivery, especially in the recent launch of your safer childcare as a relation initiative. If we can briefly ask you some questions. We know the private service provider play a critical role in ensuring access to life, saving maternal and newborn care in low-income countries. Can you please tell us about your efforts in ensuring that local private sector actors are supported while being accountable when it comes to ensuring that there is no no mother dies while giving birth, which is what UNFPA core purposes and mission, and we're all passionate about. Also, if you can briefly add to that, what role can government and international organization play as well?
Thank you so much for the question, Claudia. And it's so great to be on this call. And I think anyone watching can already understand and feel that this has to be an all of us endeavor. No one of us is alone is going to be able to help the world get to a place where no woman has to die giving life. And just being able to listen to the diversity of solutions that are targeted, to very specific needs and very specific geographies, it's just been heartening. So thank you, UNFPA, for pulling us all together and continuing to fuel the collective multi-sectoral action that's going to be needed. What I will briefly say is that we are excited, to be part of this collective action. We recently, Merck for Mothers, also known as MSD for Mothers outside of the US and Canada, recently celebrated our 10-year anniversary and launched a new collective partnership, which we're calling Strengthening Systems for Safer Childbirth. And we did this because during the COVID pandemic, we saw local actors step up to ensure that women and girls, were safe in their communities. And we wanted to make sure that we would be able to continue to fuel that momentum around local action and folks not saying no. Local private providers working and augmenting government responses, being able to pull on all of the community strengths and assets in order to continue to take care of mothers. That's the kind of energy, that's the kind of, not saying no attitude, that we want to be able to pull through, not just during COVID, but after. And so I encourage all of you, to share with your networks, this call for action and expressions of interest, so that all of the things that we're talking about here on Zoom, sitting in our offices, that folks who are actually working at the front lines can connect the dots in their local communities. And we can facilitate that kind of horizontal integration that's going to be needed to build resilient health systems that are responsive and agile to the changing needs, at the local level. So just really excited to be here. It has to be an all of us, endeavor to get to that finish line. And we all need to keep ourselves accountable to that end goal of no woman dying while giving birth.
Thank you so much for your submission. And I think you've said it, you couldn't have said it so eloquently, saying that it's everybody, all hands on deck, all partnerships on deck, and also making sure that it's actually connecting the dots to the people on front line. So I think that's a real action for everybody on this platform, that after here, it doesn't end here, but really getting down to the roots or the people that are on in the front line is something really great. Thank you for that submission. I think we're going to close our panel speakers with Jan Ivan, is a Senior Director, Health Nutrition Department at World Vision International. And World Vision International pledged to mobilize $7 billion in cash resources for maternal, newborn, child and adolescent health and nutrition between 2019 and 2030. The clock is ticking, of which 30% will be derived from private donors. $20 billion of this allocation will be invested directly in fragile contexts. Since then, COVID-19 has unraveled remarkable gains made over the past decade. So Dan, if we can ask you briefly, as a humanitarian organization operating in nearly 100 countries, who has World Vision responded and continued to safeguard the health and well-being of women and children left further behind during this crisis, particularly in fragile contexts, and what do you think, if we can ask, what do you think is the unique role of civil societies and faith-based leaders in ending maternal mortality? And maybe you can wrap it up with the UN Food System Summit as well. It's taking place next Thursday. World Vision is playing a very important role in tackling malnutrition globally. So, which is, we would like to link that also to child and maternal mortality. Could you also describe your work and the progress around all of this as part of your commitment? Do we have Dan? World Vision?
I think, Dan, you need to unmute.
No, sorry about that. Thank you, Claudia. Sorry for that. I'll jump right in. First, I'd like to share that in our most recent regional assessment in Asia across 9 countries, we've found access to maternal health centers currently at 48% and continuing to lag the pre-COVID rates of 56%, which of course wasn't very good before the pandemic either. A little bit more specifically in examples, in Thailand and Cambodia, the rates of access currently are only 30 and 33% respectively. More specifically, as an example, in one district in India, we've seen tetanus toxoid immunization drop from 80 to 47%, and early child immunization dropping from 77 to 68%. But I'd like to emphasize, very importantly, that the challenge for maternal health is much larger than health service access alone. Equally alarming have been increases in determinants such as 20 million girls dropping out of school, food security and loss of livelihood, and increasing violence, as some of the other panelists have noted. Our survey in Bangladesh, for instance, has found 60% of households reporting decreasing safety for women and girls. The year 2020 saw the largest surge in child marriages in 25 years, and an additional 10 million girls are now estimated to be married early by 2030. So what do? Well, to start, World Vision's put up, in addition to our normal work, a $350 million humanitarian response across 70 countries, which has thus far provided services to 20 million women and 29 million children. There was note amongst the panelists of the importance of frontline health workers. That's where we've been investing a lot of our support. And I think it is interesting to note that of the 184,000 community health workers that we support, 98% of them remained functional during the pandemic and during the lockdowns in their contexts. To provide perhaps a more specific example per your question around the importance of civil society and faith leaders, we've all been watching the unfolding situation in Afghanistan with great concern and special concern for women and children. But as a civil society organization, World Vision remains on the ground and fully functioning with our health services in Afghanistan today. We're running 150 mobile health clinics, and we have a current supply chain of commodities, including sexual reproductive health commodities, that's good for the next 6 months, which we're also working on provisioning beyond that time. We're continuing our training of midwives there, which has been a long-standing program and contributed significantly to the maternal mortality reduction in Afghanistan. And we've trained and supported 632 imams in Afghanistan to speak out and support women's political and social empowerment and rights. 85% of them have already spoken out publicly on these issues. And in 2020, we documented their successful intervention in preventing 32 early and forced marriages. So to close out that question, we really feel it's important that as we look at the maternal newborn health issues, we try as much as possible to take on the multi-sectoral aspect of them in all of the determinants and make sure that women and children are prioritized across sectoral interventions. In regards to the nutrition question, I really appreciate and love this question because nutrition is so often overlooked as a leading determinant of maternal and newborn health, and an issue perhaps where the least progress has been made. It's an underlying factor in about 20% of all maternal mortality and about 50% of under 5 mortality. Maternal anemia, for instance, affects at least 40% of mothers and probably has seen the least progress amongst critical maternal interventions. Pre-pregnancy underweight is significantly associated with preterm births, small for gestational age babies, and low birth weight. Pre-pregnancy overweight and obesity are associated with increased risk of hypertensive disorders, preeclampsia, and gestational diabetes. So yes, World Vision's nutrition work is extremely important. At the front end of it, we're providing community management of acute malnutrition services for 120,000 children every year, and supplemental feeding associated with those programs for 50,000 pregnant and lactating women each year. We reach another 40,000 children per year with dietary diversity counseling for their families through our Positive Deviance Hearth program. And through those 184,000 community health workers, we reach about 9 million households each year with maternal nutrition and infant and young child feeding counseling, which is very successful. There are a large host of other nutrition initiatives that we have, all very important. So I would say that much more advocacy and investment is needed to address maternal and young child malnutrition, both in nutrition direct and nutrition indirect interventions. And given the World Health Organization framework for essential nutrition actions, which I'm a big fan of, I would say that health stakeholders in particular need to take on much greater ownership of these nutrition objectives. Thanks, Claudia.
Thank you so much, Dan. I think your name actually says a world vision, because improving human security, whether it's food, health, is what the world really needs at the moment. So your world vision's innovative solutions to all of this is really impactful. And one thing that I'll briefly touch on is when it comes to developing countries, which is where you are and where I say in Accra, traditional and faith leaders are huge actors when it comes to solving some of these solutions. So I really commend the work that you're doing, because people down here were so attached to our traditional leaders and faith leaders, and they listen to them. So working to get the message down to the real people for impact is really important. And I really want to commend the work that you're doing and involving local leaders and traditional-based and faith-based people as well. So thank you. It's been a really amazing panel, having Dr. Sally with us, Chimney, John Willem, Dan, Lisa Thomas, Mary Ann. Please, thank you all for this impactful Maria Rosa. But before we leave, we have to hear from the man who holds this vision and brought all of us together with Maria Rosa. Ian Mcfarlane, who is the director for the Division of Communication and Strategic Partnership, where our lovely Maria Rosa works. If we can have Ian to close us off together, and then we will end our conversation today. Ian, please, if you're ready.
Yeah, Claudia, thank you so much. Thank you for your energy and excitement in moderating what has been a very, very rich and wide-ranging conversation with some real expertise, inspiration. It's been really wonderful to hear and share that. I think I've got kind of 3 takeaways, just very quickly to highlight what we've all been talking about. The first, I mean, it's been really impressive the way everybody has used evidence and stories. And I think that's been really powerful to convey the fact that there are needs still there, but there are solutions that are also there. And I think that's really, so those voices and stories that help us understand what the reality is, what resilience means, how we get to realize hope, I think has been really, really powerful in the conversation this morning. I think the second thing for me has been that everybody's referred to partnerships in some way or other. The fact that partnerships are needed because we all bring different things. The fact that partnerships bring out the benefit for us individually and collectively, whether we're NGO, private sector, intergovernmental, but there's a value proposition for investment around the fact that partners can create value from the way that they interact. And I think my last one is that taking those two together, this campaign around safe birth even here, the call for action that we had for Haiti, and not just those initiatives, things that even beyond anything that we're doing in this group, I think that really, really does inspire us to keep going, to find the answers, the solutions, to raise the awareness and to make a difference in the lives of those we are serving, those others who serve, and society as a whole. So it's been a really inspiring session for me. It's only my second week in this actual job, and I've just had so much inspiration coming from partners, from participants, from colleagues. It's really, really wonderful. So thank you again, everybody. Thank you, Claudia. Thank you, everybody in UNFPA who contributed, including Eve from IT Shari. And we look forward to building on this momentum and going forward. Thank you all again.
Thank you, Ian. I think one thing that clearly is that the core or aim of UNFPA is making sure that every pregnancy is wanted and every birth is safe. My soul and my heart is always at peace when I read that. And as a UNFPA ambassador, that really gives me a purpose and really pushes me to do anything that's connected to UNFPA, because I truly believe in this, especially where I come from, which is Ghana, Accra. So thank you also for this opportunity to engage with such amazing people, partners of yours. And I hope that this partnership will only get stronger and bigger and better in saving these women and these beautiful babies that keep coming. So thank you all for the opportunity, and thank you for a lovely afternoon.